who's got left leg pain, so what posture he will adopt potentially? Flexion and right side flexion. Great. Which combined movements and active movements will be provocative for this patient? And? Great. So because you will maximize the, or you minimize the size of the pain, so not provoke the pain in the leg. Good. Now active screening, I talk about, lumbar flexion with dorsiflexion should be negative. Neurodynamic test, just strictly speaking, should be negative for this patient. Nerve palpation should be negative. Neurological examination, which test will be positive? The big toe, it says halbus longus might be weak on the side, on the left toe. But also, having shown you maybe reflex of Achilles. Achilles is sort of more S1, sort of L5 S1. But also, we can show tomorrow, we have reflex hammer. We can also have for the semitendinosus. Semitendinosus also is L5. So if there is no reflex on semitendinosus, that also is a positive sign for compressive neuropathy. Okay? And sensation might be reduced where? Oh, the big toe. Excellent. And then spinal segmental test. So remember, L5 nerve root comes out between L4 and L5. So L4 probably and L5 might be painful when you push on the spine. Okay, so more that transcending nerve root gets affected because you usually get posterolateral disc prolapse. So not exiting nerve root, because remember that diagram, exiting nerve root, L4 comes down a bit higher. So you get a transcending nerve root that might be affected. But you still need to test. That's a hypothesis, isn't it? Good. Are you clear on that?
Yes.
Excellent. So good answers. All right. Now for PNS of S1, so posture what would be like? Maybe a bit of lumbar flexion and maybe right side bending, isn't it? Sorry, left side bending. Left side bending and maybe slightly flex the knee. Well, I'm giving you a perfect picture, but it's good to start sort of more in a simplistic way and then we can build on that. Good. Active movements that would provoke the pain would be flexion and right side flexion. Good. And the same thing with combined movements. Oh, no, sorry, that's what we did. Yeah. So a screening test, lumbar flexion, adding with the dorsiflexion, cervical flexion would be provoking leg symptoms. Good. Neurodynamic test, which test will be positive? Slum and straight leg raise. Nerve palpation. Most probably painful will be tibial nerve, isn't it, for S1. Maybe common peroneal, but more tibial nerve for S1. So in a popliteal fossa, when we palpate the tibial nerve, it will be a hyperalgesic response compared to the other side on the right. Very good. And reflex muscle power should be okay. Sensation should be okay for this patient. Because the driver for pain is inflammation. Yeah? And segmental spinal test, or like if you push on the spine, which levels? Maybe L5 and S1 sort of thing, a bit of a mistake, but L5 will be most painful on palpation. Good. But you see, we still have to go through a whole process. Like I said, in a clinic you might have mixed pathology. Signs of compression, signs of PNS. But I think more commonly, in a clinic you'll feel probably more that is pain more than really, typical compressive neuropathy. I think this may be more common. It depends maybe where you work and what population you see. But I still would go through the process assessing it and really making then a judgment. Is a patient got mixed pathology or really clear just inflammatory response of sciatic nerve? And that's what we do those tests. Any guys questions on that? So what we're going to do tomorrow we're going to look at the treatment of compressive neuropathy or PNS. We're going to look at also how to treat somatic referred pain. And also we do the assessment and treatment for motor control as well. Okay? And manipulation, of course. We're going to have a look first thing in the morning for manipulation. So we're going to show you. To be honest, you know what's manipulation? It's a continuation of your mobilization, adding the speed to the technique. And the key thing is, you know, when you do manipulation, it's not the force, it's a speed that you do that click, you know, or that what you call manipulation or high velocity thrust. And how it works again, so basically you probably release the gas to the joint, that's where you're getting a popping sensation. Some people love it, great, we can do it, and you feel good about it when you click. And look, if you don't click, you know what you do? You just do this. In time with this. I'm joking. And then you ask if did you hear that? Oh, that was a different click. No, it was a click. All right. Okay, guys. So have a good evening. We'll see you tomorrow.